Thank you, Excellencies, dignitaries, distinguished experts, ladies and gentlemen. I'm just skipping some of the introductory, addresses because to save time, because I believe we are running a little bit behind time, so I have to be very economic on the time front. So I'm just bringing to you greetings from our Honorable Health and Welfare Minister, Shri Mansukh Mandavia, who could not attend this ICP meeting due to urgent commitments. But with the completion of 40 years of Alma Ata Declaration recently, the ICFP 2022, under which banner we are all accumulated here in this beautiful city of Pattaya, it really makes for an apt background today to discuss family planning under the broader concept of the universal health coverage. Also, this year happens to be the 75th year of our independence, and that's a landmark event for our country. Our health system has been devastated by the COVID-19 pandemic, and this is an opportune time to revisit how we conceive, design, regulate, build, and operate strategies in our country while ensuring global solidarity. We were one of the very few countries who were fast off the track in the COVID-19 pandemic. We had our 2 indigenous vaccines, which really saved us. A country where we already have around more than 95% coverage of our population. And not just the 2, right now we have around 5 indigenous vaccines in place. And we were able to donate many of these vaccines to many of the African countries as well as many Asian countries. Somehow we believed that solidarity is the way to go and we must all act together for all humankind. Guided by the approach of One Earth, One Health, our Honorable Prime Minister Shri Modi emphasized that 2 things will define how the progressive journey of humanity will unfold in the times to come. First is the health of our people. Second is the health of our planet. Sustainable development, therefore, will thus require a multi-pronged approach. Meeting the healthcare needs of the people has multidimensional benefits, which by now all nations realize, extends beyond the health of society of social inclusion and economic development. To achieve the aim of health for all, the Alma Ata Declaration of 1978 showed the way by recognizing the importance of universal primary health care. The ICPD plus 25 further emphasized the need for universal health care. Much ahead of this, India had been the first country in the world to actually come out with a national family planning program way back in 1952. For us in India, the family planning is at the core of improving women's and children's health and empowering couples to take charge of their reproductive choice. We do not really just focus ourselves on population control or population stabilization. We believe that's a byproduct. But the more important reason that we do family planning in our country is to improve the lot of the health of the women's and children. And I'm proud and happy to announce that India has been making tremendous progress in this arena, as evidenced by the recent decline of MMR to the tune of 54% over the last decade. And that's a huge decline. Going further, we believe that we'll be able to achieve the number well before the 2030 SDG target. Also, our teenage pregnancies have reduced by more than half in just 3 years. That's a massive sort of an improvement that we have. And as Dr. Letitia mentioned about the child marriage, yes, the child marriage has to stop. So India has taken the lead. In just 6 or 7 years, our child marriage rates also reduced by half. It used to be as high as 46. Now it has come down to 22% child marriage. But the pace at which it is reducing is really transformational. And we believe that in the next 5 or 6 years, it will be only a mere 2 or 3%, on which we will have no control because some things happen far out in the rural areas of our country where maybe the light of civilization may not have reached. Also, we also have the experiences also provided us with the cognizance to move ahead on the path towards our goal and has been the result of various landmark initiatives in the healthcare arena. The total fertility rate that we are hearing from our African colleagues is something which we also take pride in because we were also one of the countries where the total fertility rate was around 6 in 1990s Right now, it has come down below 2. So say we have 36 states and union territories in our country, and of those, 31 have already achieved the total replacement level fertility of 2.1. And in fact, some of the states of our country have got the total fertility rate even lesser than some of the European countries, say less than 1 or 1.1s like that. But there are only 2 or 3 states remaining out of 36 where the fertility is still a little bit high at around 2.5 or 2.6. Otherwise, we have done pretty well on that front. Also, what we have seen is because of the total fertility rate has gone down because of one great reason, that our contraceptive prevalence rate is now touching around 70, but the modern contraceptive is around 57%. That has really contributed to our reduction of all these indicators that we are talking about. So we believe that these are some of the indicators which are telling us the which way the government is moving, the program is moving. And we have carried forward our approach of providing special attention to the underserved geographies through our Mission Parivar Vikas scheme. What we are saying is that there's no point that we should have the same policy in every state of India. We have gone to the micro level. We have around 750 districts of the country. We have focused, or rather we have identified just 146 of them where the issue of fertility is higher than the rest. So we are not really spreading our resources thin. We are putting our money where it needed to be, and there we are getting a huge dividend in terms of focusing our resources more on this 146 districts, where over the last 5 years, we have been able to increase the contraceptive prevalence rate about 17%, reduce the unmet need by more than 9%, and also added around 14 million additional users in those 146 districts. So that's the segmented and focused approach is really helped because one size cannot fit all the things. Also, parallelly, there are certain path-breaking initiatives that the government of India has taken. Many of you might have heard about the great Ayushman Bharat scheme, which says Long Live India scheme. And here, there are 2 strategies that we have really gone into. One is the comprehensive primary health care to promote the well-being, to avert the disease with continuative care and enable gatekeeping so as to reduce the burden of secondary and tertiary health facilities, thus saving cost. So the premise became the driving force for the first component of Ayushman Bharat, which is to set up 200,000 health and wellness centers at the sub-center level. In a population of say 3,000 to 5,000, we have come out with this health and wellness center, which will provide preventive, promotive, rehabilitative, and curative care. Family planning services will be built in over there itself. Then, and also, in order to cater to our population of 1.35 billion, which I just want to say 1.35 billion, it is maybe we are just second to China, but alone ourselves, we have more population than the whole of Africa taken together. So this is a huge population. So we launched the second flagship program under the Ayushman Bharat, which is of real consequence. Why I say so? Because this is the largest government-funded healthcare program anywhere across the world. It actually is bigger than USA, the Canada, as well as Mexico put together. What we have done, we have brought almost half of our population, 500 million population, that is almost half our less than half our population under the safety net. And here, what we are providing to the families to the tune of around $500,000 per year per family. That's a path-breaking initiative, and this is for their tertiary level and secondary level care that we have come out with this, and we are doing very well on this. And that is recorded and monitored through the direct benefit system. The money goes directly into the pocket, and it is electronically monitored. So the chances of corruption here is almost next to nil. With these schemes in place, the family planning beneficiaries are ensured services through the continuum of care of right from the primary to the tertiary level services. And the collective approaches have proved crucial for India's commitment for increasing contraceptive coverage under the Family Planning 2030. We were one of the founding members of the 2020 movement, and going forward transitioning, we are also a permanent member of the 2030 movement, and we have come out with new commitments under this FP 2030. So the focus strategy under the National Family Planning Program through our schemes such as the Mission Parivar Vikas, introduction of new contraceptives, home delivery of contraceptives, where our community level workers go from house to house to distribute condoms, emergency contraceptive pills, pregnancy test kits, and also spacing between children has improved tremendously with regular orientation training of service providers. Dr. Letitia mentioned about the postpartum family planning. That is the single most initiative of our government in terms of family planning. Because why I am saying so is because the institution deliveries in our country, which used to be pretty low around 15 years back, today the institution deliveries is officially at around 90%. Many states are around 99%, but some of the states are still lagging behind at 88%. When we have a captive mother in our hospital for 48 hours delivering in an hospital, there's no way we are going to send them back without some sort of contraception. So when they go back, we have the postpartum IUCDs, where we are doing around 25 lakhs or 2.5 million IUCDs we are doing every year. So that is really something is going to prevent the unintended pregnancies. And also we have a homegrown oral pill by the name of Chaya, which is only pill which is non-hormonal and can be given immediately after birth. That is also something that we are doing. So our postpartum family planning has gone up by 25%. So we are able to actually achieve that, or rather reduce the chances of unwanted pregnancy. And also we are able to increase the contraceptive uses concurrently. So these are some of the initiatives that we have taken. Moving ahead, and for accelerating our efforts, the global community needs to align their efforts and resources to help millions of beneficiaries worldwide. All of you know that India is the pharmacy of the world, and we supply commodities, whether it is family planning commodities or medicines or vaccines, to around over 150 countries in the world. And we believe forums such as the PPD, the ICFP, the showcase the plethora of work happening around the world towards this very end. And we remain committed to the South-South Triangular Cooperation and proud to be part of the PPD, and together we shall deliver. Thank you all for a patient listening.